So the thing about it, you know, some parents are a little bit skitsy now about getting their tonsils and adenoids out.
For sure.
And if they do, and they just kind of say, well, I'm not, you know, we're not going to go there, then I say, well, when I look at it, I say orthodontically, then I've really got to get the room bigger.
Absolutely.
So at least if it's crowded right now, if I make the room, I'm going to go a little bit bigger than maybe I would want to. Just, and then, yeah, at 12 years old, maybe they shrink back. But you don't want to wait until this child gets 12 or 14 when they say, well, that's the time the scammon curve, you know, drops off and the lymphoid tissue starts to drop, start to decrease at 12 or 14. What happens in that first 12 years of growth?
Yeah.
They
Well,
got
the years of
abnormal
growth, but
facial
also the
growth
years of oxygen deprivation too.
and oxygen deprivation and brain changes and cardiac changes.
Yeah.
So to me, it just doesn't, you know, it just doesn't add up.
No,
And
no.
especially
Look, this is what I
talking,
love, Bill. is that
talking
You and
to
I are
the
so much on the
ENT.
same page because we're about to say the same thing.
Yeah.
So, yeah. So, yeah. No, please, yeah, continue. I think this is a great
This
little
is something
finishing
I'm
point.
working on, and actually, it's kind of proving my point. I'm big about taking 3D images of the face in addition to the bones and the teeth with the cone beam. But I've always thought the face relates, I mean, it tells you a lot of stuff if you'll just analyze it. So, you know, patients can tend to have these dark circles under the eyes, maybe the bags under the eyes, small nose, open mouth, breathing. This group actually in Australia, on the other side of Australia, uh, took this 3D MD camera, which is what I have, and they located these landmarks on the 3D face. And you can see the predicting sleep apnea from 3D facial photography. Now think about this. Think about taking this into schools and doing this on kids and it being able to maybe recognize some potential issues.